Hi, everyone. Welcome to another episode of Keeping London Healthy. I'm your host, Dr. Mario Elia. We've got an exciting episode today. First thing we're going to be dealing with is a paper that was just released by Public Health Ontario that looked at the effectiveness of vaccines already with the vaccination effort and how it's reduced hospitalizations and deaths. So we'll show you some of that exciting data. And the second part of the episode, we're going to be dealing with some common misconceptions around the vaccines. We know a lot of you guys in your lives have been having family, friends who are hesitant to get vaccinated, and sometimes you're not really sure how to respond to them. So we're going to go through some examples of what you hear from these people and how best to respond to them. So again, another exciting episode we've got in store for you today. First thing we're going to jump right into is the paper. So again, this was a paper that was released last week by Public Health Ontario. You can actually find it online. The study was called Confirmed Cases of COVID-19 Following Vaccination in Ontario from December 14th, 2020 to April 17th, 2021. So this was not necessarily a study in the sense of that they randomized things, but they basically looked at how many people have been vaccinated, who's been vaccinated, and how has that resulted in a reduction in cases over time. So the way they did this is they took the database that all vaccines are entered in the province. That's called the COVAX database. So they know exactly who has been vaccinated and when, who has had one dose, who's had two doses. The province knows all of this information. And that's different than your usual vaccination efforts where, if I give someone their tetanus shot in the office, no one really knows that I gave it to them apart from me and the patient. But the COVAX database for COVID vaccines, again, the province is logging all of this and they know all of this data quite well. They also have something called the contact and case management database, where every positive case of COVID gets put into this database. So they know exactly who has had COVID, when they had it, whether they had symptoms, and they know all this information. So again, the province has a lot of data. And again, I was excited to see this paper last week because again, it gives us our first glimpse into, again, are vaccines having an impact, and what kind of impact are they having? We know so far in the province, out of 14.57 million Ontarians, 3.5 million or so have already been vaccinated, at least one dose. That's about 24%. So we're getting there. We're not at the US, we're not at Israel rates, but 24% we're getting there in terms of people getting their first dose. And the paper describes people in two ways. One is unvaccinated, so that if they've never received a shot, or if they're in their first 14 days after the first shot, they're described as being unvaccinated. Partially vaccinated is anyone 14 days after their first shot up until 7 days after their second shot. They would be considered partially vaccinated, and fully vaccinated would be more than 7 days after their second shot. So that's how they're breaking this down. So we know that between December 14th, 2020 and April 17th, 2021, again, 3.5 million Ontarians got their first, got one or two COVID vaccines. Okay, of all of Ontarians, we had about 273,719 people get COVID in that period of time. Around 1.87% of people got COVID. 1 in 53 Ontarians in that 4-month period got COVID. And then we take the people who were vaccinated, so that's about 3.5 million. Of those, 2,223 Ontarians who were either partially vaccinated or fully vaccinated got COVID, which is about 0.06%. Okay, so 1 in 1,571 people. So basically, your risk of getting COVID if you were unvaccinated compared to if you were vaccinated was 29 times higher between December and April. Okay, that's a big number already. And that's, again, that's early data. That's partially vaccinated people being included in that too. 29 times higher risk of getting COVID if you were completely unvaccinated compared to if you were partially or fully vaccinated. The interesting thing they found is that the majority of patients who they found got COVID post-vaccination were in that first 2 weeks, because you don't really mount that even a decent immune response to the vaccine until about 14 days after your first dose. Again, you don't mount an amazing response until after that second dose, but in that first 14 days after the first dose, you really can't consider yourself immune at all. And definitely they saw that in the data, where 2/3 of the cases were in that first 14 days. So we're going to show you some of the breakdown about how important the vaccinations have been at reducing it. A chart of hospitalizations, right? Because what are we most concerned about with COVID? We're concerned about hospitalizations, we're concerned about deaths. And if we go to the column called symptomatic COVID cases, they list there all of the hospitalizations, okay, by age. And if you add all of those up, you get to 10,203 hospitalizations due to COVID. And that's all comers, vaccinated or unvaccinated. And if you look at the column that says COVID-19 cases number, those are all people with COVID in hospital, symptomatic or not. So when you hear people make the assertion that they had COVID, but they just had it, it wasn't causing it, they died with it rather than of it, and we're miscounting all this stuff, this chart should clarify things once and for all that no, we do actually take that into account, because you see how these columns are different. The COVID cases on the right are higher than what they're listing as asymptomatic cases. So the COVID cases number on the far right, that's all comers with COVID, whether COVID is causing their hospitalization or not. That's that far right column. But that's not the column I'm even going to be looking at. I'm going to be looking at the symptomatic COVID cases. These are people with symptoms of COVID who have been diagnosed with COVID. It's a much more reliable number. Just to put that to bed, that the province doesn't track that. They very much do, and they know exactly who had COVID and where COVID was kind of just an innocent bystander to this. So again, we look back at that column there with the hospitalizations, and that was 10,203 hospitalizations. Now look at the columns partially vaccinated and breakthrough cases. 10,000. How many of them were partially vaccinated? Only 155 if we add up all of that first column there. And 108 of those were 80 plus. And if you look at, again, that time frame between December and April, that was in the second wave as well. And a lot of those were long-term care patients when some of those hadn't been fully vaccinated yet. So that number's a bit inflated as it is. But 10,000 hospitalizations and people who hadn't been vaccinated compared to 155 in those who'd even been partially vaccinated is absolutely incredible. And finally, let's look at that breakthrough case column right there. Okay, how many people who have been fully vaccinated to COVID-19 have been hospitalized in the province of Ontario between December and the end of April? 8 patients. Okay, I can't understate how impressive that is compared to the 10,000 hospitalizations of everybody who ended up with COVID. For only 8 of them to have been fully vaccinated is a huge testament to vaccination. So these are deaths due to COVID-19. So again, we're going to look at that symptomatic COVID case column. Okay, so again, stratified by age. Obviously, the biggest group is that 80 plus number, which we know. And again, a lot of that was driven by that second wave where long-term care homes were absolutely decimated. But we've had 2,790 deaths due to COVID-19 between December 14th and April 17th. It's still jarring to hear that number. 2,790 people died of COVID. And again, for those who point to the fact that, is it an overcount, that people just had COVID and didn't die of COVID? Look at that COVID case number, column on the right-hand side there. Those are all the people who died with a confirmed viral result for COVID, but maybe no symptoms. So again, that's not the column we're looking at for this, okay, because that might be a bit of an overcount. That's acknowledged. It's the symptomatic COVID case death count of 2,790. That's the column we want to look at. What effect is vaccination having? Look at the partially vaccinated case count number. How many people in Ontario between December and April have died of COVID being partially vaccinated? Only 49. Incredible, compared to almost 3,000 total. How many people have died of COVID-19 who've been fully vaccinated in the province? 0. There's no way to understate how incredible that is. May that change over time. May there be some element of someone who gets it, who's unfortunate enough to pass away from. Of course, it may not stay at 0 indefinitely, but the fact where it's still at 0 this far into it is absolutely incredible. So again, I want to pass that data along to you guys just to show, because some patients, family, friends have asked me, of all these patients in the ICU right now, what's their scoop, right? Did they get vaccinated? Did they not? Is it failing? Is it not? There's the data right in front of us here from the province showing exactly what impact it's had. So we're going to keep getting data like this probably for the next few months, and it'll show us kind of what impact the variants are having and what impact it's having on certain ages. But again, so far so good with vaccination, and it looks like it's having a tremendous impact. So after the break, we'll get back into some reader questions, looking at how to best address vaccine hesitancy in family and friends. All right, welcome back. Our next segment, we're going to be looking at some common questions and some common comments that I know a lot of you have heard from people in your lives who currently don't plan on getting vaccinated. And we're going to give you some tips on kind of how to respond to them and how to kind of best support them and hopefully, get them around to getting vaccinated. So the first thing I recommend to people first is to figure out, the person that you're interacting with, where are they on the spectrum? So are they completely vaccine resistant, where you are absolutely confident that they'll never get vaccinated in a million years and no amount of talking to them will ever convince them? Or are they vaccine hesitant, where they have some concerns, they may be open to getting vaccinated at some point, they're humming and hawing, because the reason I think that's important is because we need to pick our battles, right? I have patients who I know fully will never get vaccinated. I still encourage them and I still kind of give them a lot of the same information, but I'm not going to spend an hour, trying to convince them where I know that time may not be too useful. And I'd recommend the same thing for you, right? Because I don't want you guys wasting hours on people in your lives who will never be vaccinated. So the first thing I'd suggest, apart from kind of understanding where you're starting from, is finding common ground with them. Understanding what do we have in common. So we all want a few basic things, right? We all want this to be over. We all want the pandemic to be over. We want to get back to our lives. We want kids back in schools. We want people to open up their businesses. We want to be able to not have to wear masks. All of these things, all of us share, right? So we start with that kind of premise so that we're not starting on two different teams. We're not starting with two different ideologies. We're all wanting to get to the same point in the end. And then the question I pose to them is, well, we want it to be over. How do we get there? Because we know this virus, without any other interventions, with the things we've been doing so far, will just keep coming back, right? We've got a third wave now, a fourth wave will come soon, then a fifth wave, and this is just going to keep coming. And we know what the government's response to this will be, because they have a few ICU beds. We're going to get restrictions yet again. So I pose to people in that if you're not going to get vaccinated, how do we then get past this? Right? What are they proposing as their next steps? And the idea that we just let things go and we don't get vaccinated and we don't have restrictions, well, then ICU beds get filled up, and then it's not there when you have a heart attack and you actually need it. So what's their alternative? Because truthfully, as much as we hate the idea maybe for some of us getting vaccinated, it is our true tool out of this and our true tool to get to some sense of normal. Okay, so again, finding common ground, kind of starting that premise, and then finding out kind of where their reservations are coming from. So I break it down into a few big groups that I've heard from patients and from other people, kind of what their big concerns are. So the first group, I'll describe it as those who are minimizing the impact of the pandemic as a justification for not getting vaccine. The argument that my body will be able to deal with COVID. Most people survive COVID, so I'll take my chances. Or I barely leave the house, so I don't need it to protect me. Or this has all been blown out of proportion. Or some people saying, oh, I can just take a drug if I get sick with COVID. The last one, definitely not true. There's no medications that are actually, the best med we have is probably 30% effective against serious COVID. And the rest of those minimizing, the thing I push back on people is that, yes, 99 to 99.5% of people survive with COVID. Okay. But it's that, 0.5 to 1% who die of COVID. It's those people who end up in the ICU. It's the people who have the long-standing symptoms. Minimizing it doesn't change their outcome. And if you allow a virus to not be stopped at all, we all end up being affected by this. So again, vaccination is our individual way of stopping transmission with us, stopping it from being passed on. And again, so get a sense, if someone's minimizing it, the response to that would be, dealing with the reality of how serious this actually is. The fact it's affecting people who are at a younger age. It's affecting people without comorbidities. It's not just old people anymore. So again, if they're minimizing it, dealing with the reality of how serious COVID is, that should be your focus with them. The second thing I hear from people is I'll call it kind of autonomy type people. I will make my own decision and what's best for my family. You can't make that decision for me. I know what's best for my family. Or the government can't force me to do anything. Sometimes there's a bit of a personality issue with a lot of the individuals who you'll hear say this thing. So again, sometimes just kind of forcing something on them, lecturing these people, probably won't get very far, because again, they've staked their ground as being individualistic, and the idea that they're doing something for the collective isn't necessarily making any progress. So sometimes with people who are taking this approach, you almost kind of have to kind of massage them a little bit, massaging their ego, letting them know that yes, it is their decision in the end, but what can we do for each other, right? And if it's someone, finding out what their trigger point is. So is it that they want to get their kids back to school? Is it that they want to get back to work? Is it, what is that trigger point for them? And what's going to make them make that decision for them individually to get vaccinated? Because sometimes, again, they're not going to be looking at the collective and the importance of getting vaccinated for the collective. The next big group is those, I'll call them the delayers, right? So those who aren't necessarily opposed to it, but they're not just ready right now. So they're waiting to see, I want to see what COVID looks like in the summer. I'll wait for herd immunity and then I'll see where we're at. I want to see what the studies look like on the vaccines kind of longer term and seeing if there's more side effects. The way to respond to them is really making sure they understand that this is a real issue and a real pressing issue right now, given cases, and that if we all took that delay approach, the likelihood of a fourth wave would be much higher. The likelihood of this wave coming down as quickly as we want it to would be much higher. So yes, in a perfect world, would we all be able to press pause on the pandemic, take a deep breath, and then make a decision about the vaccine 6 months from now? Yeah, sure. But that's not the reality that we're in. We're in a reality where we want to get these numbers down ASAP. We want to get back to normal as quickly as possible. So again, the delaying is really just absolving our responsibility to get this under control. The next big group I'll describe is the should be better group. They're not opposed to the vaccine, but they're creating this bar above which that they would expect the vaccine to meet. So, it's not 100% effective, so what's the point? Or the vaccine's mutating and they're worried about the vaccine not working on the variants. Or saying that COVID won't stop transmission to others, so they won't get it. Or it hasn't received full approval in the US, so they won't get it. So let me address some of these things. So the 100% effectiveness thing. So the vaccines we have right now have been shown so far to be nearly 100% effective against preventing severe disease. As we saw in the Ontario data, we saw that earlier in the episode, but whether it's Pfizer, Moderna, AstraZeneca, Johnson & Johnson to come, in preventing severe disease, they've all shown to be nearly 100% effective. Will the variants play any role? The UK variant, they all look to be quite effective against. And even the South African variant and the Brazil variant, from data from Qatar, look like they're actually quite effective too. Now, is there always the risk of variants down the road, maybe having and the vaccine not working as well? It's always a possibility, but we need to deal with the reality that the majority of cases right now in Ontario are the UK variant, smaller proportions of the South African variant and the Brazil variant, smaller proportions still yet of the variant from India. So again, we need to battle the thing in front of you, and that is those variants we have, which our vaccines work quite well against. Will it stop transmission to others? We know now that the Pfizer vaccine and the AstraZeneca and the Moderna do stop and lower transmission to others. Because initially there was a concern that, well, yeah, it would work for you, but would it help to lower viral spread to other people? Yes, that looks like it is the case now. So you getting vaccinated is not just a personal decision at this point. You're actually doing your part to lower transmission to others. That we know as well. The vaccine's not receiving full approval in the US. This is largely a bureaucratic issue, meaning a paper pushing issue of them needing to go through the process. But the studies that we have that we can look at and look at the data are quite impressive. Health Canada has granted full approval to these, so no concerns from that standpoint. The next group we're going to look at are the group concerned about side effects. So we'll go through these one by one because I've heard some helpful feedback from some viewers about things that they've heard from friends and family of theirs. So number one, unknown long-term side effects in the future is something that we commonly hear. What are the effects of this vaccine going to be years from now? And am I making a decision now that I'm going to regret in a number of years? So here's the important thing we need to know about that. When we give you a vaccine to COVID, what are we doing? We're giving you the code for your body to produce a small amount of the spike protein. That's all the vaccine is doing. And the vaccine response to your body is to create immune cells so that your body knows how to respond to COVID next time it's exposed to it. So that's all we're doing, is giving you spike protein and your body training itself to respond to spike protein. Compared to getting the virus, if you actually get COVID, what happens? Your body is then full of virus particles that are spreading, that are dividing, and each of those virus particles has a ton of spike protein on it, amongst other things that the virus comes along with. So the idea that we're worried about the long-term impact of being exposed to a spike protein and your body's response to it cannot be nowhere near as significant as the long-term effects of actually getting COVID-19. Because this is not a decision between getting vaccinated or not. The decision ultimately with how contagious COVID is, over the next number of years, you will either get vaccinated or you'll get COVID. And I've heard from people saying, well, I'd rather get COVID. And I'd point out to them that that is an inherently illogical approach to take, because again, like we just said, you're exposing yourself to not only spike protein but a lot more stuff. So the analogy I give is people who are allergic to peanut butter, and they're going through allergy shots to essentially decrease the intensity of their peanut reaction. So how do we do it? Well, we give them, sometimes we do sensitization. We give them very, very small amounts, and their body kind of gets used to it over time. The analogy here with someone saying they'd rather get COVID is someone saying, well, just give me the whole jar of peanut butter. I'll take it all myself, because I'd rather deal with the natural consequences of that, which we would rightly see as, not a good idea. So again, expose yourself to a small amount of something that can train your body and won't be serious versus the consequences of actually getting COVID. Other things I've heard from people is that, concerns about affecting fertility and affecting your period. That has all been online, myths, unfortunately, that have really permeated through social media. That is not true. We know that stressor to your body can cause changes to your period, and some people who have reported issues with their period after getting the COVID vaccine could very well be from unrelated changes. But studies to date have not shown any changes with your period, so no concerns about fertility. Other things we've heard is that it changes your DNA. It absolutely does not do that. It can't possibly do that. Strokes after the vaccine, and again, we know the risk of AstraZeneca is a 1 in 100,000 risk of getting a very specific type of clot within 1 to 4 weeks after getting the vaccine. And that's a known risk, and that's only been with the AstraZeneca so far, and again, a very low risk. Another concern with the vaccine making the virus more dangerous down the road. Again, the main concern about COVID is that if you allow it to spread, then it mutates, and then you get more mutants. But if we vaccinate and keep the overall rates low, it spreads less, it divides less, and then it won't mutate as much. So the real risk is letting it divide uncontrolled, letting it spread through the population, and that would be a major concern to the rate of mutations. Concerns about people dying after they get the vaccine. Again, these are over-exaggerated social media reports. Again, we're vaccinating billions of people around the world. Some people unrelated to the vaccine are going to have complications afterwards. It doesn't mean that the vaccine caused it. I know we've dealt with this a number of times on the show. And the last thing I want to deal with is this issue of vaccine shedding. Anti-vaxxers have been all over this for the last few weeks, saying that if you get vaccinated, then you're the risk because you're shedding spike protein to other people. That's not a real thing. That's a bit of psychological projection on their behalf, because for months they've been told that they're the dirty ones by not wearing masks and by not getting vaccinated. And this is kind of their twisted way of turning this around on people, that the people who are vaccinated are suddenly going to be shedding things. That's not actually real. That's not actually scientific. And the last group we want to deal with very quickly is the conspiracy ideology people. And these are people who believe that there's chips in the vaccine, and pharma is behind all of this, and the big reset. Justin Trudeau is gonna reset the economy, and why is pharma involved in governments? And again, this is a big topic, but again, if this is the group that you're dealing with, the approach is going to be very different than the rest of them, because again, most of us understand why microchips in vaccines is not a real thing, and Bill Gates is not behind this, but that's a very different approach to then dealing with the side effects. So the reason I bring all of this up to you guys is that when you come across someone who's not going to get a vaccine, if you start assuming they're conspiracy minded, where they're just concerned about side effects, the approach needs to be different, right? Or if they think the vaccine should be better, that's going to be a different approach than if they just don't think COVID is relevant. So again, tailor your approach, listen to people when they're telling you that they're not going to get a vaccine, find out where they're coming from, and tailor your message to them is what I would say. We'll be right back after this break. All right, welcome back. Thanks for joining us again today. And if you find us on social media, we'd love to hear from you, to hear what your reasons are for getting vaccinated and to hear some of your stories. I can tell you personally, why am I getting vaccinated? A few reasons. Number one, I work in healthcare, and if I carry COVID and give it to my patients, that would absolutely be devastating. I have 3 elderly grandparents. I have in-laws and parents with medical issues. Again, me getting the COVID vaccine is very little about myself and preventing myself from getting COVID as much as it is preventing it from giving it to others. And really, that needs to be the approach that a lot of us, especially young people, take in why we get vaccinated and what we can do. All right, so thanks again for joining us, and keep healthy.